Avoidant. What is avoidant personality disorder?
Avoidant personality disorder is characterized by pervasive social inhibition accompanied by feelings of inadequacy and hypersensitivity.
What are the signs of avoidant personality disorder?
You'll see someone who is reluctant to initiate new activities. These people will be so fearful of criticism that they will anticipate it in advance. And therefore, that's where the social inhibition comes in. They're incredibly shy. They don't like to have, they don't want to initiate conversations. They don't want to speak out in class or, even at work. They'll refuse promotions if it means they have to supervise individuals because they don't want to have that responsibility. They don't want people getting mad at them. Even though they're incredibly shy, these people long to be accepted. So it's very subjectively unpleasant for them. They realize, but they will do almost anything to avoid getting criticized or humiliated.
What causes avoidant personality disorder?
I don't think there is a known cause of avoidant personality disorder. I would tell you it is associated with childhood shyness. However, childhood shyness is not considered to be a risk factor. So it's definitely an association. In other words, everyone you see with avoidant personality disorder will have been shy as a child. However, the converse is not true, that shyness is not, predispose one to develop avoidant personality disorder. A lot of people are shy as children and outgrow it and go on to become outgoing, exuberant adults.
What are the dangers of avoidant personality disorder?
Socially, obviously, again, part of the diagnosis is that social inhibition. So these people view themselves as rather socially inept and they are terrified of engaging in any kind of thing that they might perceive as socially risky, which is just about everything. So they tend to have, a very small social network. Perhaps what would be typical is your best friend since kindergarten and maybe your sister. Those are your two friends that you do anything with. Occupationally, again, while you might be competent and able to do certain jobs, you will turn them down or not be interested in them because they might involve dealing with people. And you're not willing to put yourself at risk to be criticized.
Who is at risk for avoidant personality disorder?
The male-to-female ratio in avoidant personality disorder appears to be about equal, 1-to-1. However, in boys, it tends to be a little bit earlier onset and much more disabling. And I think that's because in today's society, women can still get away with being shy and withdrawn a little bit easier than men. There are other kinds of expectations placed on men that aren't true for women.
What are the treatments for avoidant personality disorder?
Again, there's no treatment specifically for the avoidant personality disorder itself. However, since these patients are prone to lots of anxiety and sometimes depression, if they meet criteria for any of those mood or anxiety disorders, they should certainly be treated in the standard way. One other thing that might be helpful is, for anticipatory anxiety, a small dose of beta blocker on an as-needed basis can often be very helpful. For example, if it is required for you to present at a meeting for your job, you don't have an option of getting out of it or refusing to do it unless you want to lose your job. Sometimes a low dose of beta blocker will help you get over the sheer terror that you will experience, when you have to go and give that presentation.